Health Minister Dr. Frank Anthony, during Tuesday's COVID-19 update, disclosed that the government is eyeing several proposed sites for the establishment of a mobile COVID-19 hospital.
President Irfan Ali has spoken to the Emir of Qatar, and we are working on getting a field hospital to Guyana. And so those discussions are ongoing, and in fact they're in a very advanced stage. So we're expecting very shortly that we'll have those arrangements in place, and we'll start getting those material in to set up that field hospital.
The field hospital, also known as a large mobile medical unit, will be used to temporarily care for casualties on site before they are safely transported to a more permanent medical institution.
We have identified some potential sites, but we're waiting on the finalization of those discussions. We have proposed certain sites, and we are waiting on those discussions to finalize before we announce where we are putting it.
He anticipates that the mobile hospital will detect more COVID-19 cases in far-fetched areas. Meanwhile, with hopes of an effective vaccine against COVID-19 being bolstered with the announcement of large-scale clinical trial data from Pfizer, BioNTech, and Moderna, suggesting their vaccine candidates are more effective, Guyana could be one step closer to preventing the disease through immunization. Dr. Anthony was questioned about Guyana's preparedness for the possibility of acquiring either of the two vaccines. He noted that as a member of the COVAX facility, there is a high chance that either of the vaccines will be distributed to Guyana once approved by the various regulatory bodies. However, the requisite storage mechanisms will first have to be put in place.
That's going to pose a challenge because in our cold chain network in Guyana, we don't have such refrigerators. So if we are getting those types of vaccines, it would mean that we have to buy these refrigerators and put that type of infrastructure in place.
The health minister informed that Moderna vaccine is more compatible with the country's existing cold chain system.
So that is very hopeful and very optimistic news that you have a vaccine now that we can use with our existing infrastructure. But we'll see, because we are getting these vaccines through COVAX, and we'll see what arrangements COVAX would make.
Frontline workers in the healthcare system and other categories of the workforce are first in line to be immunized locally. Subsequently, the vaccine will be given to persons with underlying conditions such as diabetes, cancer, HIV, and the elderly. Timeka Rodney reporting for the HGP Nightly News.